The nurse practitioner interviewed NP thought leaders Dr. Dabrow Woods and Dr. Karen Innocent to discuss the importance of the Doctor of Nursing Practice degree. Here's our interview with these well-respected nurse practitioners.
Hello, my name is Dr. Dabrow Woods, and I am the Chief Nurse of Wolters Kluwer Health Learning Research and Practice. I am also a practicing acute care nurse practitioner for Penn Medicine Chester County Hospital, as well as adjunct faculty for Drexel University.
Hello, I'm Dr. Karen Innocent. I am Executive Director of Continuing Education for Wolters Kluwer, and my responsibilities here are for continuing education for nurses, physicians, and allied health professionals.
Why did you get your DNP?
I became a nurse practitioner in 1998, and while my education was excellent, to be able to practice as a nurse practitioner, when you look at what's happening in healthcare today and how things are changing with the paradigm moving from fee-for-service to value-based care, as well as the complexity of care is really changing, I really felt that having my nurse practitioner degree wasn't quite enough. So it was really a personal decision for me, as well as a decision to really help me in my 3 different roles to move forward. Certainly what I was taught in school to become an NP didn't really teach me a lot about population health or the social determinants of health, as well as really using evidence in practice and the whole idea about critical appraisal. You just weren't taught that. Or, anything about implementation science. How do you really get the evidence into practice? In addition, it really didn't teach me about systems approach and how you can look at a healthcare system, whether it be at an organizational level, a unit level, whether you look at it at a local, a national, or an international level. It didn't teach me anything about really looking at it differently and seeing what we really had to do to move the needle to improve patient outcomes. And also, I really didn't have the knowledge of how to really improve practice and improve patient outcomes. So that's really what I was going for, and that's why I decided to go on to get my Doctor of Nursing Practice.
For me, I wanted to go into a doctoral program from when I started my master's program. So I went to my master's degree and completed that, and shortly after I looked into doctoral programs, and the only thing available for nurses was the PhD. And at the time, the curriculum really did not fit what I thought my career would be as a nurse. So I decided not to go. I wasn't planning to go into academia, and I wasn't planning to be a researcher. And those curricula were focused around many courses in research and the curriculum development and education, which would not have helped me in my role as a nurse practitioner in a clinical setting, and did not necessarily translate even to my role here at Wolters Kluwer. So I held off from doing that, but I was very excited when I learned about the intent of establishing a new program for nurse practitioners and other nurses who were not intending to earn a PhD. That practice doctorate was kind of up my alley. And so I researched it. I looked into the American Association of Colleges of Nursing website and learned everything that I could about the DNP programs. At the time that I was looking, there were only 6 DNP programs in the country. I started my DNP program in 2010. So I was among, some of the first few graduates in the DNP. So they really have evolved since then. But my reasoning for doing it was I looked at the curriculum, and the curriculum covered things that did help me in my role in professional development. It did include a lot of implementation of research, translational research of how do we apply it to improving patient care outcomes? How do we apply of research to improving nursing practice. So it was something that I could use in a practice role as well as a professional development role.
Where did you get your DNP from, and how did it make a difference for you?
So in 2010, I really started looking at some of the different programs that are out there for nurse practitioners and other nurses to go on for further degrees after you've received your master's. And what really tweaked my interest in the DNP, which is really why I want to go there, is because the whole purpose of the DNP is to award a degree that reflects the expert clinical competencies required by healthcare providers to meet the challenging healthcare needs of individuals and changing healthcare system. And that's a definition by AACN. And that really struck a chord with me. So I started to look at different programs that really focused on that whole concept, as well as the concept of translational research, implementation science, as well as evidence-based practice, and looking at system analysis. And it took me to Texas Christian University. I was very impressed with their program. I currently live in Pennsylvania, so I went for a program that was pretty much online only. We had to go down to to the orientation, but we also had to go to defend our capstone project as well as graduation. But I chose them because they were really focused on what to me were the most important things and what I wanted to do in my professional career, which was around really being able to improve practice, systems, implement evidence into practice, and then really improve the practice environment so patient outcomes could be improved. So that's why I chose Texas Christian University.
How did the DNP help you professionally, and how did it help you in your role?
It certainly made a huge difference in my life. Not so much, I certainly was in the chief nurse role to begin with, but it helped me to be a better chief nurse. It helped me have a better understanding of all those things that are important to healthcare in general from a local, national, and international level, but it also really helped me in my role defining what are the things that we as a company are going to focus on building for clinicians. And certainly in my role in practice, it helped me have a greater appreciation that when we're treating one patient, we're really not treating one patient, we're treating the community. And that really needs to be the focus of healthcare organizations. And certainly in my role as adjunct faculty, it's helped me tremendously because we need to teach all the upcoming students the importance of all these things related to population health and evidence-based practice and critical appraisal, as well as system analysis. And it gave me that knowledge I needed to be able to translate that information into knowledge for my students.
I went to the George Washington University, and I chose George Washington University because I took to the blogosphere for some advice on what schools to go to. And at the time, as I mentioned, the DNP was fairly new, and there weren't really any ratings out there at the time on what is a good school. So I just started searching for information just from other students and graduates on where they went to school and which schools they liked, and just getting more anecdotal information about what the experience was. I did need to go to school online because I was working full time and I had 3 children under the age of 5. And so I needed to have a program that worked with my life and work schedule. So George Washington University was one of the few at the time that had a 100% online program with minimal in-person requirements. So only once a year you had to go on campus. So that fit my life and needs, but also the program and how they taught the program, and just getting seeing some good reviews from students was what helped me make the decision. But it was amazing for me when I started the DNP program. I was able to use the information I learned in my first semester right away to start improving my performance in my role. What I was amazed by was that there was sometimes terminology that was used by editors and other PhD researchers that I wasn't familiar with. And occasionally I'd have to, let me see, what does that mean? And I have to look it up and try to get an understanding. So that was a big piece for me, that having better understanding of research, being able to critically appraise the articles that my team has to work with and then apply to educational programs. It helped me in my ability to even review posters for our conferences and determine those that have good value and that are sound from a research basis to include in our conferences. So there were several things that I was able to use right away, but I think the main thing that I could use was that we learned early on some of the systems thinking, the ability to use analytical thinking and also to synthesize knowledge. We problem solve at a very different level than nurses do with a master's degree. And that was important because, the problems that we have are bigger, they're more complex, they're expensive problems, and we have to come up with a lot of detailed ways of how to resolve problems. And I just feel a lot more prepared to do that with the DNP.
How does the DNP degree make job candidates stand out?
Well, I think if you talk to any nurse, they'll tell you that we have to adhere to this whole concept of lifelong learning. So having a clinician or a researcher, whomever, go on for additional education is so vitally important. And for me, looking at different candidates, someone who's taken the time to invest in that further education to really understand what's going on in healthcare, evidence-based practice, systems theory, critical thinking. To me, they made that investment because they really are dedicated to improving the profession. So for me, having a candidate who has that DNP really does make a lot of difference to me. It shows that they really desire to make that investment into their future, but also into the profession's future.
I would agree with Dr. Woods just said, that the DNP does help the candidates for a job to make more critical decisions, and it is important for them to be able to solve problems and to address things in a bigger picture format. One of the things that I recognize that as I was looking for opportunities in the DNP programs, I just wanted to find out what were the different employers looking for at the time. I wasn't necessarily changing jobs, but I was wondering if there would be an opportunity. And at the time, this was about 9 years ago, there weren't many positions that had DNP as a requirement for the job, but now there are. Almost all positions for nursing professional development leaders, for chief nurses, for vice presidents of nursing, require a DNP. And so this has really changed from the past, that there is an understanding that there is a need for higher level thinking and problem solving that you don't have with the master's degree. While it was very important for us back in the 1980s and 90s to have a master's degree, it might have only helped us so far in regard to our ability to provide higher level clinical practice. It might have gotten us to an advanced practice role, but in order to run complex healthcare systems, you do need to have that higher level thinking that the DNP provides.
How would a potential student know that the DNP is right for them?
The first thing anyone needs to do is just look at their own career goals and their own professional aspirations. And the DNP is just one option for nurses, and we know there's another option, PhD. But for nurses who are looking for career-oriented advancement, they have to look and see, are there requirements for the type of position that they'd like to have in the future for one degree or another? Are they planning to eventually become a dean of a school of nursing? Do they want to go into research? The DNP would not be the appropriate degree for them if you do need to become tenured faculty and to be a researcher. So for people who are looking for opportunities that are around translation of research into practice, they may want to go into a clinical setting and to be a leader of a magnet program, or they may want to be a nurse executive or an advanced practice nurse who was leading other advanced practice nurses in a clinical setting, then a DNP would be an appropriate choice for that person.
I agree with everything Dr. Innocent said. I think it's really a personal decision, and you really have to look within yourself to determine where you want to go in your career trajectory. And for me, it was definitely, I love practice. I love looking at healthcare systems and helping to analyze them and make decisions that are really going to improve not only overall practice for clinicians, but the bottom line is going to improve patient care and their outcomes. That to me is the number one thing. So I think if somebody really wants to stay around the whole concept of improving patient care, patient-centered care, evidence-based practice, I think the DNP is absolutely the right degree for them. I think that if someone's very interested in original research, building curricula in our academic settings or going on to be a dean, I think then the PhD is a better alternative. I think they're both equally important and we need to have both. But I think for those of us that are more pushed to the practice side, that's where we are pulled to, then I think the DNP is absolutely the right one for you.
What does the future of the DNP look like?
Because I do see that there are opportunities in that area. I really can't say, statistically where that actually is growing. I mean, I can just say in general that it is growing. Mm-hmm. There are many graduates. So as there are more DNPs, the opportunities, it will be more competitive. That's something that I can anticipate. When there was fewer fish in the sea, it wasn't nearly as competitive. Sure. But now that we're graduating more than 5,000 new DNPs a year, there aren't as many jobs to go around for the DNPs.
I think for the future for the DNP is really bright. I think that because healthcare is changing so quickly, we've shifted from are shifting from this whole fee-for-service model here in the U.S. to value-based care. In other countries, they're really focused on more socialized medicine. Things are changing so quickly, and I think the DNP is perfectly positioned because of what they are taught throughout their curriculum. We're perfectly positioned to really help in the analysis and help in the improvement process to improve overall patient care. And especially here in the U.S., really focusing on population health. So I think there's going to be great opportunity for the DNP in the roles of being system leaders, being people who are in charge of the magnet journey, people who are in charge of quality improvement throughout organizations. I mean, all you have to do is look at the statistics around the DNP. So, in 2006, when they really started talking about this new program, right now we are up to 336 DNP programs in the United States today. 54 of those are post-baccalaureate, and the rest are pretty much postmaster's degrees. That's a huge shift and a huge growth potential that we've seen. So I think that the DNP, it's going to be a huge growth area, but it also is the people who have their DNPs are going to have the ability to write the future for themselves and really help frame where we're going with healthcare, not only here in the United States, but on a global basis.
What are the biggest challenges associated with the DNP?
I think one of the biggest challenges with the DNP is, number one, acceptance in today's healthcare arena. I think it's very easy to look at the PhD and see its value, because the PhD has been established in areas like science and pharmacy and physical therapy and psychology for quite a long time, where the DNP is really a relatively new degree. It's only been around since 2006. So really defining who we are and where we're going, I think that's going to be one of our biggest challenges. And understanding that the DNP degree is an educational degree, it is not a practice degree, and we cannot get those two things confused. Just because you have a DNP does not mean you're an advanced practice nurse. So I think that we need to really be able to articulate what the DNP is, what it isn't, and then really look at future state of where the DNP can go.
The challenges that I've seen with the DNP degree have sometimes occurred within our own field with a comparison of the DNP degree to the PhD, as if there's a hierarchy that puts the DNP below the PhD. And as Dr. Woods said, that it's a different path of taking a PhD or DNP, but they are not necessarily indicating that one has a higher level of practice than another. You can have a PhD nurse who is an advanced practice nurse or who is not an advanced practice nurse. You have DNP nurses who are advanced practice or who are not advanced practice. The only requirement that you have for either is that you have an RN. You only must be a registered nurse to earn a DNP. So it's really isn't a hierarchy that puts the PhD necessarily higher than the DNP. So that's really, I think, the only challenge that I've seen. I've seen some positive things in that regard, where PhD nurse practitioners are going back to school and getting DNPs. They too realized that they did not have the appropriate education in their PhD programs to support population health, improvement in quality of patient care, and determine the social determinants of health, and even how to develop their own practice. You spend a lot of time on quality of care, ensuring that you know how to develop a sound program in your DNP programs. They develop you in terms of your ability to go beyond your clinical practice as an individual to clinical practice as someone who can manage a team, who can manage a health system, or who can manage a clinic on your own. So all of those things, I've seen PhD nurse practitioners go back to school because they were able to fill some of those gaps that they had in their education.
In closing, I just want to say, as far as Dr. Innocent and myself, I think that when we first became nurses, neither of us could imagine getting a doctoral degree, and we did that. And I think that anyone who's contemplating that, whether they have a bachelor's degree or currently a master's degree, I would say do it. I think the two best decisions I ever made in my nursing career over the past 30 years has been, the first one was to get my master's degree to become a nurse practitioner. And second one was to get my DNP degree, because from the day I set foot into those DNP classes, I was able to use every single thing that I learned immediately into what I do as a professional nurse. So Dr. Innocent, what would you say in your closing words?
Well, I encourage all nurses to really evaluate your lifelong learning on an ongoing basis, to make decisions for yourself depending on how long you plan to still stay in your career. We are all in different phases of our careers. We are all in different phases of our lives. So I really would encourage all nurses to consider a Doctor of Nursing practice or any other advanced degree that you think will help you to achieve your goals.
This podcast does not constitute medical advice and should not be taken as such, and does not replace professional judgment or advice. The ideas and viewpoints expressed in this podcast do not reflect the official position of the speakers, authors, affiliated organizations, the Nurse Practitioner Journal, or Wolters Kluwer.